Hello everyone, welcome to US Residency Training and Beyond. I am Dr. Viswanath Aluru, attending physician in physical medicine and rehabilitation at Optional Health in New Orleans. In this video, we will continue with our topic admissions. So last video, we started on admissions topic. So one thing you have to remember is sometimes you do a consult on a patient, some other department consulted your service or attending for some expert opinion, and then you decided to bring the patient on your service. In that situation, you have to write a consult note and then an admission note. So because you already have reviewed this patient case, so you might have already known everything about this patient's background, why this patient is coming to your service, and everything. But say sometimes you may never know about this patient who is coming from some other different hospital, some other facility that you are admitting to your service. So in that situation, you have to do a thorough evaluation of all the documents available from the other facility, and so it's important to understand what's going on with the patient, how are they managing this patient currently, what's the current situation of the patient, why is this patient coming to your service, because you have to kind of enter all that information in your admission note. In the same way, so if the patient is coming from some outside facility, so you need to request the transporters and the discharge summary notes. So sometimes they all come with the patient. So the EMS, whoever brings the patient to your floor, they will actually drop off like a folder or like a packet that has all that information. So it's important that you should thoroughly evaluate. Sometimes you are not on call physician and you handed over all your patients before you left, and then the on-call physician might have admitted a patient that you never know about. So you come next day morning, the on-call physician will give a sign out to you saying that so-and-so patient came yesterday from so-and-so service or from so-and-so department or hospital. In that situation also, you need to know about this patient. So the bottom line is, it's for all new patients who are coming to your attending service, you should have a thorough understanding of the patient. So when the patient comes to your floor, first review all the charts, all the documentation coming with the patient, or it's already in the chart. Then you have to immediately go see the patient, talk to the patient. If the patient is not able to give you more information, talk to the family members or call the family members to find out what's going on with the patient and do a thorough evaluation. And then you have to put in your admission note. It's very important you finish the admission note on time and also thoroughly. So it's why the patient is here, from where the patient is coming from, what's the admission date, what's the admitting diagnosis of the patient, who is the attending under which the admission being processed, and the history of present illness, family history, social history, past medical history, past surgical history, any allergies to medications, what type of medications the patient is on, IVF systems, physical examination, vitals, labs, imaging, and your any other pertinent findings, families, and then your assessment and your plan. If you're a rehab resident, the way I do it is, for plan you should need to have like an admitting diagnosis and the plan for the admitting diagnosis, and then your continuous monitoring, like what things you're monitoring for this patient, and then other medical comorbidities, other medical management. And then you also need to give them some direction to the rehab department, like what they need to focus on in terms of rehab services, so rehab plan of care. So in that way you divide your plan if you're doing like a rehab admission, history and physical note. So when you're putting, so that's regarding your note. But even before the note, when the patient comes to the floor, the nurses will call you saying that we need orders for this patient, because they need to admit the patient on their side. They need to know what to do with this patient, right? So that's why you have to put in a admission orders. So the first thing is, you should have a active admission. So and so patient is being admitted to so and so attending physician on so and so date with so and so diagnosis. That's your admitting order. And then you need to have other admission related orders. For example, most important is the code status, resuscitation orders. So if you already doesn't have a resuscitation order or code status order in the file on the computer, It's important that you talk to the patient or the family or whoever is the healthcare attorney or proxy for the patient and find out what needs to be done if there is some kind of acute situation on the floor, whether it's like a full resuscitation efforts, like a full code, or a partial resuscitation efforts, or no resuscitation, or DNR, it's called do not resuscitate. So that order needs to be in the computer active at all times. That's your resuscitation order. And the next most important thing is the diet order. So it's important for you to pay attention to medical conditions, medical comorbidities when you're placing a diet order. Does this patient have any heart conditions that needs to be taken into account, or diabetes, or is the patient has a kidney problem or on dialysis, or is the patient is on any medications that needs to be also considered when placing a diet order. Does the patient have like a fluid overload? Does the patient need to be on fluid restriction? And especially if you're dealing with the neurological patients like strokes, brain injuries, or other neurological conditions, you need to know whether the patient can tolerate regular food, or does the patient need like a modified diet plan. Do you already have a modified diet plan? Or if you don't know whether the patient can tolerate regular food, and if you don't see a modified diet plan, you need to consult your speech swallow evaluation specialist. Make them do like a bedside swallow eval to make sure what the patient can tolerate. This is where people, residents, can actually go wrong, because sometimes they don't pay attention to what diet order they have to put. And also when you're placing diet orders, so you have to pay attention to solid type of food and also liquid type of food. Solid type of food have to be in one specific consistency, whether it is regular consistency or it's like a soft consistency or minced and moist type of there are different consistencies for soft solid food. Same thing with the liquid food. Can they drink like a liquid, clear liquids, or it has to be like a nectar thick or honey thick? That's most important thing you need to know about. That's why chart checking and background information checking is very important. So the diet orders, and then you have to put some nursing orders. So what the nurses need to do, for example, if the patient has skin problems, wound care issues, that needs to be addressed. So you need to have specific wound care orders. That's why on admission, it's important to do like a thorough, like a skin evaluation, like a body survey, to know if there are any wounds, any skin breakdowns, so you can document them thoroughly and address appropriately. Because if you don't document, then how do you know? Because if something developed on the floor, or that the patient come with some kind of existing condition, so you need to document and treat accordingly properly in order to control the situation. So that's one important, like wound care orders. If the patient is coming with any lines, drains, or any other tubes that needs to be taken care of, you need to write specific orders for all those things, so the nurses know how to manage all those things. The patients sometimes come with like a nothing by mouth, like NPO order, and the patient might have a G tube or a J tube. So in that situation, when you're placing a diet order, you put NPO diet, and then you have to put what kind of tube feeding the patients can tolerate. If the patient has a new PET tube, you need to consult the nutrition registered dietitian to start the patient on a very low diet and see how the patient is tolerating, and then gradually progress the patient. In that situation, you need to put in a clear diet order for tube feeding. And then coming back to the nursing order, so we talked about skin wound care, we talked about lines, drains, or any IV ports, central lines, peripheral lines, all those things. And also, you need to have activity related orders. So, for example, the patient might have admitted for like a fracture or a post surgery. You need to know, are there any weight bearing restrictions, what type of weight bearing restriction, or any precautions like a cardiac precautions or spine precautions. If the patient had a surgery like cardiac surgery or a back surgery, or if the patient had like a brain surgery, the patient need to be on seizure precautions, fall precautions, those kind of things. So the activity related orders, any precautions specific to the patient related to the condition, nursing orders. And also you need to have like a vital checks, how often you want the nurses to check the vitals and document, and ins and outs, like for example, if the patient we are monitoring for fluid overload, how often do you need to check those ins and outs, any outputs from any lines or tubes, and that's important as well. And those are on the weight checks. If the patient is like a CHF patient or a renal patient, then you have to check weights more often, sometimes every day. Those are the nursing. Sometimes you have to tell the nurses, hey, please tell me know if there is any change of condition. That's why you have to put notify physician kind of order. So when the nurses need to call you or notify you if there is any change in condition, like blood pressure changes, heart rate changes, pulse, respiratory changes, or any other important changes, so notify physician orders need to be also entered in the computer. Any isolation orders, if the patient is coming on any isolation, like a contact isolation, dropped isolation, so you need to know if there's any reason why the patient need to be on isolation, then you should put specific isolation orders. That's also very important. And also prophylaxis orders. We'll talk about prophylaxis orders when we discuss about medications, but these are the most important orders that you have to put in the computer for the patient when they come to your service, so the nurses know what to do, how to act on those orders, and how to manage for the patient. With this, I'm going to end this video. In the next video, we will continue with the admission process. We will discuss mainly about medications. Okay, thank you, and I hope you all enjoy my videos. I will see you all soon. Thank you.